Phantoms and ghosts are apparitions of spirit, not real, and yet there is scientific support for such haunting and mysterious visions. Start with the human brain, the control center, receiving signals from 5 senses and redirecting them through the memory circuits, weighing and processing thoughts, and then creating new outgoing signals for muscle contraction to send a basketball arching through the air to swoosh through a net. To force air through vocal cords to make musical notes of perfect harmony, or even to push a button switching channels to watch this TV show. But if that's not interesting enough, when sensory input is lost for the blind, the deaf, the amputee, we've learned that the brain fills in with phantom images, sounds, and even body parts. Take, for example, phantom visions of the blind called Charles Bonnet syndrome. First described in 1769, Swiss naturalist Charles Bonnet noted the hallucinations of his 89-year-old grandfather, who saw smaller than normal faces, birds, trees, patterns like tapestry all from his failing eyes. Oliver Sacks, a famous neurologist and writer, tells us that you don't have to have failing vision, and that most of us have hallucinations normally as we first close our eyes to go to sleep, often with swirling patterns. The take-home message from Bonnet and Sacks is to reassure us that visual hallucinations can be very normal, simply reflecting the brain filling in when vision is diminished. Also, there are phantom sounds of the hearing deprived called tinnitus, and rarely musical ear syndrome. The first is a simple bother to ignore, and the second a complex form of auditory hallucinations to admire. Apparently great composers, Robert Schumann and Dmitri Shostakovich, both described hearing phantom symphonies in their heads from which they drew inspiration for composing music we still hear today. Similarly, people who have lost a limb sometimes sense that the limb is still there, and this is called phantom limb syndrome. Unfortunately, these hallucinatory limbs can become painful and too often are unresponsive to the standard pain medicines and treatment. Recently, promising research, however, is bringing relief for some suffering with phantom limb pain by using mirrors reflecting the real limb in order to teach the amputee to unclench or relax the phantom limb. Imagine that. When there is loss, the human brain fills in with phantom images, sounds, and limbs. And even though they're not part of the real world, they are real to our minds, and we need to deal with them.